Yeah, to start with, after radiotherapy is finished, I had a monthly checkup, and then as time went on, the frequency of those checkups gradually diminishes. It goes from once every month to once every 2 months to once every 3 months, until in the final year, the 5th year, it's once every 6 months. And then at the end of 5 years, and my 5 years was up in June of this year, at the end of 5 years they say they don't want to see you anymore, or they don't need to see you anymore. And that's an interesting experience, because on the one hand it's a celebration that you've achieved 5 years of being completely free of the disease, but for those 5 years you've had the best of surgeons closely examining your throat, looking at you very carefully, looking for signs of return of the disease, and now it's not going to happen anymore. So it's mixed blessings at the end of 5 years. Something some patients have a bit of difficulty coping with. Some patients ask to be included for a little bit longer. I think in my case, at the end of the 5 years, I was happy for that cessation of the checkup routine. I was confident that I've beaten the disease, happy that the checkup routine is finished, and that life is back to normal. The good news about head and neck cancer is that if a patient presents early, it's very treatable, very curable. Something like above an 80% success rate for patients that present with stage 1 or 2 tumours. The bad news is that so much of our functionality takes place in this area, and the longer the disease goes on, the worse the effects on the individual. Of course, things like eating, drinking and speaking take place in this area, as well as other things like balance and hearing. And although it's very curable, it can adversely impair the quality of life afterwards. If you lose a section of your tongue, for example, that's clearly going to affect your ability to eat and speak and swallow, and even do simple things like clean your teeth after a meal. The habit of running your tongue around your teeth to clean after a meal becomes very difficult. As part of my surgery, I had 2 saliva glands under my chin removed, and then the radiotherapy to this side of my face also adversely affected a number of my saliva glands. So out of the 8, I think, that we normally have, I probably have got a couple that still work to some extent. So I suffer with what is called dry mouth. I don't have as much saliva as everybody else, which from a practical prospect, eating and drinking means that when I eat, I have to choose foods that are moist. If I'm eating a meal, for example, I will always pick a meal that has some sauce with it to give me that extra moisture in my mouth. I would always have a drink in front of me, for example, because I find that towards the end of the meal, I have very little saliva left, and I can top that up with a little drink of water. One of the other side effects of dry mouth, of course, is additional tooth decay, because saliva is the natural protector of our teeth. So I have to use a special high fluoride toothpaste. By way of giving something back, I suppose, I decided that I wanted to train as a supporter and to help other people through what is clearly a very difficult stage of their lives. So I was trained by Macmillan as a cancer supporter, and now I work as a supporter for a support group called Heads Together. a diagnosis of cancer is a bolt out of the blue. I've heard it described as having the carpet whipped out from under your feet. I've heard it described as a train crash that comes into your life. I think the one I like the most is I heard Sheryl Crow, the singer, she's recovering from breast cancer at the moment, and I heard her describe it as a life reboot. And it is certainly that. Things that used to be important to you seem trivial. You might have been flashed by a speed camera yesterday and might be worrying about that summons that's going to pop through the letterbox. It matters not one iota when you're not sure if you're going to be alive in 3 months' time. The moment that you're given a diagnosis of cancer, you pass your life over to other people, you put it in other people's hands. You will be prodded and poked and examined and told what to do, and of course you do it willingly because you want to get better, but you effectively give up control of your life for a period of time. There's a number of things that I can do as a supporter. The first is I can stand in front of a patient as a survivor and say, look, I got better and you can do it too. The second thing I can do is start to give them information about what is going to happen to them, about their treatment, about their outcomes, and where they're likely to be in 3 months' time and 6 months' time, and to answer their questions. So they will go from knowing nothing about what has happened to them to gradually, bit by bit, gaining information about what has happened to them and is likely to happen to them, and thereby get, bit by bit, a little bit of control back into their lives. A bit more information. It gives people the ability to rationalise what has happened to them, and possibly even to the point of making choices about their treatment and about the way forward. So bit by bit they start to get a little bit of control back into their lives.